I, Dr. Vidhi Tiwari, as a demonstrator, Index Department of Physiotherapy and Paramedical Sciences. Today's my topic is paraplegia. Paraplegia, an impairment in motor or sensory function of the lower extremities. Paraplegia is the word comes from Greek language. Para plus plesin means strike at sight. Paraplegia is defined as impairment in motor function of the lower extremities with or without involvement of sensory system. It is usually caused by involvement of cerebral cortex, spinal cord, the nerves supplying the muscles of lower limbs, or due to involvement of the muscles directly. Complete paralysis is paraplegia, whereas partially paralysis is known as paraparesis. Paraplegia is of two types depending upon the part of nervous system involved and resulting tone, spastic paraplegia and flaccid paraplegia. Both upper limbs plus both lower limbs, quadriplegia, one upper limb, monoplegia. Paraplegia. Paraplegia is divided into two, spastic paraplegia and flaccid paraplegia. Spastic paraplegia is two types, paraplegia in extension and paraplegia in flexion. Spastic paraplegia, weakness of muscles along with increased tone. Second, it occurs in upper motor neuron disease due to loss of inhibition of contraction. Third, increased muscle tone, exaggerated deep tendon reflexes, plantar extension with or without clonus. Further, it is divided in two types paraplegia, in extension and paraplegia in flexion. Paraplegia and extension. First, occurs in initial stage or partial transaction of spinal cord with involvement of pyramidal tract. Hypertonia is more in extensor group of muscles. Next, paraplegia and flexion occurs as the disease or lesion progress further or with complete transaction of a spinal cord. Extrapyramidal tract get involved leads to more hypertonia and flexor group of muscles, resulting in flex posture of limbs. Flaccid paraplegia. First, decreased tone and contractility of muscles along with weakness. Second, it occurs in lower motor neuron disease. Third, due to loss of stimulatory innervation to muscle. Fourth, decreased muscle tone, atrophied muscles, absent deep tendon flexes, flexor or equivocal plantars with or without fasciculation. Paraplegia in extension and paraplegia in flexion. Some causes. Paraplegia in extension, pyramidal lesion, paraplegia in flexion, pyramidal and extrapyramidal lesion. Hypertonia, paraplegia in extension, more in extensors, paraplegia in flexion, more in flexors. Position of lower limb, extended, paraplegia and flexion, flexed. Deep reflexes, paraplegia and extension, exaggerated, paraplegia and flexion, less exaggerated. Clonus, paraplegia and extension present, paraplegia and flexion absent. Mass reflex, paraplegia and extension absent, paraplegia and flexion may be present. Bladder, precipitatory and paraplegia and flexion, automatic bladder. Causes of spastic paraplegia, upper motor neuron type. Gradual onset. First, cerebral causes. Cerebral diplegia, parasagittal meningioma. Spinal causes. First, compressive. Second, non-compressive. Motor neuron disease, multiple sclerosis, fragile ataxia, subacute combined degeneration. Compressive etiology. Intramedullary 5% is the first glioma, second ependymoma, third chordoma. Extramedullary. Next, intradural, 15%. First, meningioma. Second, neurofibroma. Third, patchy arachnoiditis, TB and syphilis. Extradural 80%. First, caries spine. Second, myeloma, lymphoma, metastatic deposit in vertebra. Third, patchy meningitis. Fourth, prolapse intervertebral disc. Sudden onset, cerebral causes. Thrombosis of unpaired anterior cerebral artery, superior sagittal sinus thrombosis. Spinal causes. First, acute transverse myelitis. Second, injury to spinal cord. Third, thrombosis of anterior spinal artery. Fourth, hematomylia. Fifth, post-vaccinal. Sixth, prolapse intervertebral disc. Causes of flaccid paraplegia. Lower motor neuron type. Upper motor neuron lesion in shock stage. Sudden onset in neural shock. Acute transverse myelitis and spinal injury. Lower motor neuron lesion involving anterior horn cells or peripheral nerves. First, acute anterior polymyelitis. Second, acute infective polyneuropathy. Third, progressive muscular atrophy. Disease affecting posterior nerve roots, taps dorsalis. Disease affecting myoneural junction. First, myasthenia gravis. Second, periodic paralysis due to hypo or hyperkalemia. Disease affecting muscles, myopathy, and hysterical paralysis. Thank you.